Hi, my name is Dr. Timothy Woodward. I'm an Associate Professor of Medicine at Mayo Clinic, Jacksonville. In this forthcoming issue of Gastrointestinal Endoscopy, you will be seeing a study in which we were comparing devices and injection materials in endoscopic mucosal resection. There have been very few randomized studies looking at these issues. The particular aim of this study was to compare a combined needle and snare unit, the eye snare, to that of a spiral wire snare, in this case, SnareMaster. In addition, we are looking at comparisons between lifting agents, saline versus hydroxymethylcellulose. EMR has been demonstrated over the years to be a safe and effective method for removal of large, laterally spreading lesions. Removal of these lesions requires technical expertise as well as special devices, for example, a particular snare such as a spiral oblique snare, or particular lifting agents, for example, saline versus hydroxymethylcellulose. It's important to have a submucosal lift to form a cushion so that the submucosa may be expanded and removed from the muscularis propria. This is important in performing a successful EMR. At our facility, we routinely use saline or hydroxymethylcellulose. Over the years, both have been found to be effective and of low cost. Additionally, EMR technique targets the removal of lesions in as few pieces as possible. The rationale to limiting the number of resection specimens stems from studies performed and a marker developed by the group in Australia. The rationale for limiting the number of resection specimens stems from the fact that each resection is a potential source for error. Undertreatment leads to residual lesions. The Sydney Resection Quotient, SRQ, was developed and helps to define the size of the polyp divided by the number of pieces resected. The SRQ was higher in our study with the combined unit, that is the eye snare, in comparison to the braided snare. The median was 13.8 millimeters versus 7.1. Our study demonstrated that the SRQ was higher with the combined unit. Additionally, procedure time was less, median being 6 minutes versus 11 minutes. Resection was considered complete after the EMR in 62% with the combined needle and snare versus the 51% with the spiral snare. Rates of adverse events were found to be similar. Residual neoplasia was found at follow-up, be 22% with the combined unit versus 21% with the spiral wire snare. There was no difference in outcomes by lifting agents. The limitations of this study include that the SRQ is only a surrogate marker. The study, though, does provide evidence that the integrated needle snare may be superior to the snare alone for removal of large flat polyps. Additionally, type of injectate appears to have no impact upon outcome. Thank you.